Hello and welcome back. So, I want to say thank you so much for your support. I have received some good feedback from you guys telling me how these classes are very helpful and you've been able to be helped, and that really encourages me to keep on doing these videos because I am encouraged that I am helping someone. So today I want us to look at third trimester danger signs, and before we do that, I want us to start with some words of wisdom from the book of chapter Luke chapter 12, verse 40. The Bible says, Luke chapter 12 verse 40, the Bible says that you also must be ready, for the Son of Man is coming at an hour you do not expect. So we all have to be ready because Jesus Christ will come at an hour when we do not expect. So let us dive into it. And if you are new here, please consider subscribing to our YouTube channel, Doctor on Wheels, and you can also follow us in our social media platforms. That is Zawadi Premier Hospital _ Ngong for Instagram, and Zawadi Premier Hospital Ngong for our Facebook page. Now, by far, most of the third trimester danger signs go hand in hand with the second trimester danger signs, but there will be some few discrepancies here and there. But then, one thing that we need to be able to know is that third trimester, which basically is from 28 weeks all the way to term, that is around 38 completed weeks to around 40 weeks, we do not call any kind of bleeding at that point. We do not call it, or the delivery, we don't call it miscarriage. So we call it delivery because if this baby is delivered at a hospital that is well equipped, okay, the baby can be supported and actually they can survive. So then we don't call it a miscarriage, we call it delivery. So one of the danger signs that you need to be aware about is vaginal bleeding. And here with vaginal bleeding, there are three major things that can cause that. So we talked about placenta abruptio, where the placenta separates from the wall of the uterus. But also when you have the placenta that is covering the internal os, okay, of the cervix, okay, what we call placenta previa. So the baby at that time, the baby has, it's big enough, okay, so the baby can start actually coming down. It's third trimester, so from 28 weeks all the way up to 38, but that is 26 to 38. So the baby can start coming down, what we call the baby can start coming down, and as the baby comes down, they can press on that placenta, which is actually around the cervix, and that can actually cause some bleeding. But then sometimes you can also get loose fetal vessels that are passing through, especially around the cord, that are passing near where the cervix is. Okay, so as either the head of the baby, as it comes into contact with the cervix, it can actually press on those vessels and they can start to bleed. So now that we will call it more of antepartum before delivery. Okay, so antepartum hemorrhage. Okay, so you need to be aware about that. So once such thing happens, you need to be able to rush to the hospital, because the risk with that is that you can get, once you start bleeding, okay, and the contact between the mother and the baby is through the placenta, then the cord, okay, the umbilical cord to the baby. So if you start bleeding and it is the placenta that is affected, what it means is that you will end up with placental insufficiency, and placental insufficiency means that the baby will not be able to get enough food, okay, or enough nutrients, and therefore you can end up with fetal distress, and you can even lose that baby. So do not wait, please rush to the hospital. The second danger sign that you need to be aware about is severe abdominal pain, and the abdominal pain basically will come hand in hand with the bleeding, number one, but also infections. Okay, we talked about very many infections that can cause severe abdominal pains, like urinary tract infection. Okay, we talked about ovarian torsion, but also non-maternal or non-pregnant conditions that can cause abdominal pains, okay, which include basically appendicitis and all the rest that can cause abdominal pain. So anytime you feel abdominal pain during pregnancy, don't wait, please rush to the hospital so that you're able to be assessed and ensure that the baby and the mother is safe. Now, the other thing that you need to be aware about, third danger sign, is severe headache, blurring of vision, and dizziness. And this one mostly it's caused by preeclampsia, when you have high blood pressure during pregnancy, what we call hypertensive diseases in pregnancy. So that one can cause dizziness, it can cause headache, blurring of vision, it can even cause convulsions, okay? And the risk is that if you end up having those high blood pressures that are not well controlled during pregnancy, it means then you can easily bleed even in the brain, and you can actually develop stroke during that time. So don't hesitate. Don't wait, please. Anytime such thing happens, severe headache, blurring of vision, dizziness, okay, and even fainting attacks, okay, please go to the hospital. And this one comes hand in hand with the fourth danger sign, that is swelling, okay? So swelling around the face, swelling around the hands, swelling around the lower limbs, okay, around the legs, okay? That one is a danger sign to show that probably you might be having high blood pressure and you need to be assessed. Now, that swelling can also be as a result of kidney failure, okay? So one thing leads to another. Either the hypertension can lead to kidney failure, or kidney failure can lead to hypertension. Then the other thing that you need to be aware about is that anemia or low HB, okay, can also lead to swelling of the lower limb because of fluid retention. Okay, now with fluid retention, it means then therefore you give a lot of strain to your heart, okay, because the heart has to pump against a lot of fluid. So that one can actually lead to heart failure. And that's why you need to be very aware that actually anemia can lead to heart failure in pregnancy. So you need to be checked. And especially for the time when you go in for your ANC or antenatal clinic, and we realize that your blood level is very low. If the doctor advises you for transfusion, please don't. I know I have met with different people. You have a HB of 7, okay, and the person is pregnant, is at third trimester, and you advise them for transfusion because of the risks that are involved, and the patient actually declines. And here you're trying to save both the life of the mother but also the life of the baby. So if the HB is too low, you will need to be transfused, and if it is just mild, then basically you'll have to keep on using the hematinics to be able to boost your HB. Now, the other thing that you need to be aware about is reduced fetal movements or absent fetal movements. And that one can be, most of the time, it is as a result of the things we have talked about. So if you have vaginal bleeding, you have placental insufficiency, and the baby gets into distress, so it means then the baby will basically either stop moving, okay, and if care is not given, then it means then that baby can actually die inside. The other thing that can cause that placental insufficiency is high blood pressure during pregnancy, like what we have discussed about preeclampsia and eclampsia. Okay, it can also lead to placental insufficiency. The other condition that leads to placental insufficiency as well is diabetes. When you have high uncontrolled blood blood glucose level, okay, very high blood glucose level during pregnancy, and it's not well controlled, it can lead to placental insufficiency. And what happens here is that it leads to early aging of the placenta. So you realize that the blood vessels that are sending nutrients to the baby actually start to age, and what it means then, therefore, they will not be very effective in terms of delivering the nutrients that are required for the baby to be able to grow healthy. So you need to be aware about that. Okay, those are some of the conditions that really need to be checked, okay, during pregnancy. And therefore, anytime you still feel the baby is not playing the normally, okay, you need to be able to go to the hospital as soon as possible, okay, because your baby might be in danger. Now, probably the second last that you need to be aware about is shortness of breath. Okay, so shortness of breath might be the only sign that comes in, especially when you're having either heart failure as a result of uncontrolled or persistently anemia. We talked about anemia causing heart failure. The second thing that can cause shortness of breath, so basically with heart failure, you end up with a lot of fluid in the lungs, and then the heart is pumping, but then it's not very effective. So then you end up with a lot of difficulties in breathing. Okay, but then the other thing that can cause difficulty in breathing in the second trimester danger signs, we talked about something called deep venous thrombosis, where you have blood clotting in your veins. When the blood clots in your veins, the clot can actually travel all the way from the legs all the way to the heart, and then it is pumped, okay, to the lungs. And when it gets into the lungs, it can block the vessels in the lungs. And once the vessels in the lungs are blocked, okay, so then you can end up with some difficulty in breathing, okay, what we call pulmonary embolism. So that is something that you need to be aware about. Difficulty in breathing or shortness of breath, easy fatigability, okay, chest pain, okay, you need to be aware about, and if that happens, you need to be rushed to the hospital. Okay, now last but not least, we talked about drainage of live, or drainage of some the fluid that covers the baby, okay, the amniotic fluid. Okay, so before 37 weeks of pregnancy, if that thing happens, you need to rush to the hospital, and most of the time it can be caused by infections such as chorioamnionitis, and also it can be as a result of any other issue. So any kind of gush of fluid, okay, you need to go to the hospital. And actually the truth is, every time there is fluid that comes out, okay, even if you are past 37 weeks, okay, and fluid comes out, okay, you need to go to the hospital, because that might be the only sign that you are actually getting into labor, and therefore you need to be assessed, and also you need to be helped. Okay, now so lastly, you need to be able to be aware of signs of preterm labor. So basically, these are the normal signs of labor, where there is increase in terms of abdominal pain and contraction, and those contractions basically will radiate to the back. But then at this time, the baby is not yet term. Okay, the baby has not yet reached 38 weeks. Okay, so a lot of things can cause that. Number one, of course, we talked about infection. Number two is when you have multiple pregnancy. So basically the abdomen, the uterus has been stretched to the maximum, and therefore it reaches a point of like, now this is the maximum we can go, and now we have to start contracting to get rid of everything that is in the uterus. Okay, so those are some of the things that you need to be aware about. Okay, and the dangers of giving birth to a baby that is not term include basically the most feared is respiratory distress syndrome. Okay, because the lungs are not fully mature. Okay, and if the lungs are not fully mature, it means then the baby will not be able to breathe well, and that is where the problem is. And most of these babies who are born prematurely, they will end up with respiratory distress syndrome, okay, or difficulty in breathing, and they will not be able to survive. And then the one of the most feared infection that basically has very high mortality rate is what we call necrotizing enterocolitis, which basically it's an infection that basically gets preterm babies are prone to. So those are some of the things that you need to be aware, so that you're able to protect that baby from preterm labor, from being born before term. Okay, so that you are able to prevent most of these complications that come with delivering a preterm baby. That is by far most the danger signs that you need to be aware about. And if you have any question, please don't hesitate to comment below, and I will take time to be able to go through your comments. And thank you so much for your support. There is someone who actually told me that these classes have been very helpful, and they were really waiting for the third trimester danger signs because they were on third trimester, and this video is for you. So please enjoy, leave a comment, and tell us how helpful these classes are. If you're new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels, and also in our social media platforms. You can also visit us at our hospital. We are located at Loops Hill Center, that is Ngong, opposite Yuango Petrol Station, ground floor, and I'm sure you will be able to get quality services at our hospital, and I'm sure you will be able to like them. Until next time, God bless you so much.